Our top focus this morning is on the Omicron threat. The variant is spreading across the world. Over 17 countries so far have reported and confirmed cases of the Omicron variant of coronavirus. And in such a situation, India is getting geared up to tackle this latest threat. The lower house of the parliament, Lok Sabha, is likely to discuss the issue today. The mutated variant of COVID-19 will be discussed in Lok Sabha under the rule of 193. Discussion under this rule essentially doesn't involve a formal motion before the House. Union Health Minister Mansukh Mandviya is likely to discuss the mutated variant as well as the measures being taken by the government to prevent the transmission of Omicron. Now, the discussion is expected to happen at around 2 p.m. this afternoon in the Lok Sabha. In the wake of Omicron, the Maharashtra and Delhi governments have asked the central government to ban flights from South Africa and concerned hotspot countries. The centre has already directed all states and union territories to screen and test international passengers rigorously. More than 19 countries have reported cases of Omicron so far. Fortunately, as of now, no cases have been reported here in India. To what the WHO chief has had to say on the new variant and the information that we have at hand so far about Omicron.
We shouldn't need another wake-up call. We should all be wide awake to the threat of this virus. But Omicron's very emergence is another reminder that although many of us might think we're done with COVID-19, it's not done with us. We're living through a cycle of panic and neglect. Hard-won gains could vanish in an instant. Our most immediate task, therefore, is to end this pandemic.
Let's take this across to Vidya. She's joining us live from Mumbai. Remember that the new international guidelines come into effect today. So she's reporting for us from the Chhatrapati Shivaji International Airport. Vidya, good morning. Mumbai, we're seeing a lot more steps being taken by the authorities, so much so that people and travelers, we understand, who come from the at-risk nations have to mandatorily quarantine, and that is institutional quarantine.
Well, certainly, in fact, the passengers who will be coming from high-risk countries, there are about 11 to 17 of these countries. All of them will be, segregated from the passengers who are coming from non-high-risk countries. And as soon as the segregation happens, heavy testing will be done. There are many counters inside the airport that have been opened up for RT-PCR. And if in case a person has transit, route that they'll be taking, then immediate antigen tests will also be done. So certainly, apart from quarantining facilities, there are also heavily testing that will be done right here at the airport, so that the spread of the virus can really be contained right here.